Okay. I worked on the medical approach actually because I wanted you people learn the medicine approach, because almost in 1/3 of the station which we are going to encounter in the lab 2 exam, they will be pure based on the medicine. The same approach you can apply that almost 1/3 of the station, and rest of the station which are not medicine even. This approach is going to help you regarding the surgery, regarding whatever, because the basic backbone will be the same. Whenever we will be in the history taking station, almost half of your exam based scenario will be history taking station. You have to take the history some way or the other. It could be like you are explaining the results, you are taking history regarding any surgery. So more or less, even you are going to deal with the gynae, you are going to deal with the peds. More or less the approach will remain the same almost in half of your station, like in at least 8 out of 16 station would be the same approach, will some changes. Okay, first of all, it is important for us to learn about the backbone of history taking and management part. Then we will be able to learn about the variations, which variation we will be needing. Okay, so that's why today I'm going to take more of your time in making you learn this approach. It will look like a bit difficult to you initially, but whenever you will grasp this approach, all these almost 200 of the station or 150 of the station will look quite easier for you. That's why I was working like more on developing this approach. So okay, I'm going to share it with you so that we can start our formal lecture on learning the medicine and history taking. Okay, guys, you can see my video is the screen. Yeah, is that clear to everybody? Because then we will be starting on what we are going to study today. Can you see my screen clearly? Okay. So but I want you people to see the lecture notes. I think the screen is not shared, so I want to share the screen because it is important that you see the lecture notes, not me. Okay, now you can see the lecture notes as well. Yeah, okay, got it. Okay, first of all, let me tell you that what we are going to study today, we are going to have the case presentation as well. I will be needing your participation as well in that. But before, let me start with my history taking approach. First of all, I called it the medicine approach because the medicine, if we learn the medicine approach, then we can like imply it to anything else with subtle like changes. So data gathering, first of all, medicine approach, the data gathering. In data gathering, we will be studying for how we start taking the history. Okay, grips, HOPI, complete the history. HOPI is separate thing and the complete the history is separate thing. Okay, I zoom. Now it is zoom in. Now can you people see it clearly? Now it is clear to everybody, the screen of the notes, it is clear. Okay, that's fine. Okay, then we are going to study in a very detail, even the what questions we are going to ask in a very detail. Data gathering, what sort of question we ask, and what thing we take into the consideration when asking for the data gathering. Then will come the management plan, which will include the fourth thing: disclosure of diagnosis, telling your decision, targeted management, and long-term management. And this is sub-classification as well. The third thing is interpersonal skill. Okay, you should know what does mean interpersonal skill. For example, when we are going to start our station, that is data gathering, because first 4 minutes we will consume, or 5 minutes, ideally is 4 minutes. If we consume 4 minutes in data gathering, that would be the ideal. However, the rest of the time we will be like spending on management. But this part, interpersonal skill, is for whole of the station. Even when you are entering in the room, your IPS skills have been observed, like how you approach the patient, how you like see the patient. Your IPS is actually your behavior. I would say single word with your IPS, not to making it very confusing. It is your behavior with the patient, with the environment, with the everything. It is accordingly behavior, not your behavior, but you think it is the good behavior. Actually, according to the management and according to that environment, your behavior, it is suiting that or not. We will be discussing it when come to that point. Okay, I have divided it to IPS in the data gathering and IPS in the management. This for the purpose of your learning, so that you do not miss anything. Then we will be discussing the common deficiencies in approaches: history, management, IPS, and other. And lastly, the most common causes of failure, the exam failure. There are 3 causes which I will tell you in the end. So today lecture will be a bit more theoretical, but we will be making it the practical with your involvement, because it is very much necessary you to learn these kind of questions. Okay, start our medicine approach, data gathering. The first thing that comes in our mind is grapes. Grapes is like starting off your conversation. I have like mentioned a few templates. You can have your own template. This is not like the only lines which I have written are the good one. You can have the better line than me. I'm just demonstrating what does mean the grapes. Grapes is actually like your opening. Sometimes we find, even I have been teaching OET, and there are a few students with me. We know that in the speaking and in the writing, it is basically quite difficult to open the conversation. When we open our conversation in a very good way, then we can carry it on in a brilliant way. Our confidence is like higher, and we can continue it. Okay, so for us it is important to open the conversation. When we are entering in the cubicle and there is a patient sitting around, and like examiner is there, we went and we speak our GMC number 7778506. Okay, and you approach to the patient, and patient is sitting in a particular way. He may be weeping, he may be sitting, whatever he is there. So that your IPS will be starting from here. For example, hello, how are you? Okay, if you go inside the cubicle, there is written, this is your follow-up patient. For example, it can be written, it is the second visit, the first follow-up visit, and she came with some benign condition, and that was, you have to follow, make a follow-up of that condition. What you will say? You should analyze the situation. Hello, how are you? You can ask that. My name is Dr. Hamid, one of the AVI in the GP surgery. Is that fine if I call you Smith? When you can speak that. Overwritten is that like it is written John Smith, or it is written Smith Johns. Okay, whenever you have to take the first name, who you can be taken the first name, like the person is young, the person is not that old, it's not. Otherwise, you will ask the patient, can I confirm your name and age, please? Or you can, if the patient is on the similar way on the follow-up visit, you need to say, okay, Mr. David Smith, how may I address you? Because you need to ask a senior citizen that, how may I address you? Otherwise, the person is 30 or 40 year. In the UK culture, it is very common. You can say, okay, is that okay? I call you Smith. It will save your time, because in this station, in these history kind of station, we need to save our time. It is quite important. So these are kind of the greet, Grips is for greet. Okay, I greet, hello, this is my greeting. Repo building is like, how are you? I said, how are you? This is my repo building with the person. Introduction. My name is Dr. Hamid, one of the in the general surgery. Then the purpose are the paraphrase. Okay, that is even the introduction part is that fine, I call you Mr. Smith. How can I help you? That is the purpose. You are asking for the purpose. And last one is the smile should be on your face. If you are saying that, it should be like, hello, my name is Dr. Hamid, one of the FY working in the department. Can I confirm your name and age, please? Is that okay? I call you Smith. Okay, Smith, what is the purpose of your visit today? So see, I have maintained smile at my face, but whether I like it or not, I have to because it carries marks. Okay, so you people have to as well. Similarly, the situation is different. Like it was a follow-up, then other condition comes, then it is not the follow-up, first time visit. So you should ask, can I confirm your name and age, please? Okay, then it comes that sometimes like you say, hello, how are you, Sarah? You can ask directly, how are you, Sarah? Okay, because the person is young and there is no condition like it is a serious condition. She came just for a follow-up visit or like that, you know about the information. So any of these kinds, you can start your conversation. You can even make 2 or 3 more templates, but make the templates because it is quite important that you should have your own templates when to start the conversation. So not at the time you have been thinking, you have been translating in your mind how to start the conversation, and you've been stumbling over there, and your conversation is not open in an appropriate way, and then you lose your confidence and rest of the station. Trust me, half of your station is passed just because of your good confidence. Confidence doesn't mean that you are being like authoritative. That means that you are approaching like a good doctor. So you have a confidence in you. Half of the station is passed. If whether you know about its management or not, half the station is passed. Okay. So starting your conversation with a brilliant way, with a very comfortable way is quite important. For that, I try to explain the grips. You can have read that in every notes, the grips. We start our conversation with grips. So grips is not a static condition. So you need to, for example, the repo building part is quite different. You need to greet, okay? And sometimes you cannot pass the smile if the patient is written over there outside that the patient is having the cancer and you have to open the news. You cannot pass that smile because it is a serious condition. No. So it is all about accordingly, but the most of the time, like 90% cases, you need a smile on your faces, okay, to start the conversation. Please write down because it is important part. I know I'm taking a long on this part, but trust me, this part is quite important because you are going to start like almost every station with this thing. So even that are not the medicine part of the station, you are going to start with the grapes. So it is important for me to teach you in a good way. If you people have any question, you can note it down. We can talk later on because we do not break the continuity. Please note down your question. We are going to talk on that. Okay. Second part now comes to HOPI. HOPI, the first thing that comes in mind, history of the presenting illness. Okay, so that is the thing in which we are going to cover certain things. So after asking what has brought you here today, okay, or it can be 2 type of scenario. Medicine scenario can be 2 type: follow-up visit, or it can be your first visit. First, I teach you the follow-up visit. Because why I'm teaching first the follow-up visit, it is just because the rest of the thing in the follow-up visit and in the first visit will remain same. Only these 4 questions are going to be added in the follow-up visit. What are they? You will be asking about his first visit. Okay. You will be asking these 4 questions. For example, the person had abdominal pain. Now you ordered some test, and now the person came to check his test, or she just came. You called him on follow-up after 7 days. These 4 questions you are going to ask. What was the reason you came first time? What investigation they did? What you were told at the time, and what treatment you were offered? Because it is quite important that there could be another GP who has attended that person, or even you, after you have seen so many patients. So you need to ask these 4 questions if the person is on the follow-up visit. For example, the person is to come about the discuss report. You are going to say, okay, Mr. Matthew, you must be here to discuss about the reports we have ordered last week. Before I need to ask a few questions. You can start. What was the reason that you made to do these tests, and what investigation are there? So you need to not ask, and what you were told about your condition, and what you offered any treatment. So these 4 questions you are going to ask. Then you are going to say, okay, I have your results with me. However, we are going to discuss your result later on. Let me ask a few more questions so that I can have a better understanding to tell you what is appropriate for you, what is best in interest of your health. Why? Because the thing you are going to ask in the history, that is what you are going to tackle in the management. If you have not asked in the history, then what management you are going to offer? He has certain set of questions in his mind, which examiners has given to them. They are going to ask you. If you have not asked these questions, how you are going to answer that? For example, the cause can be like, she's not taking exercise, she's not doing exercise, she's not taking like regular diet. So if you have not asked this question, how you can say, what is the reason, doc, I am having this pain? What is the reason that, doc, you told me that I'm having high risk factor for cardiomyocardial infarction? Why is that? So if you have not asked in the data, keep in mind, we cannot jump. This is actually structured meeting. This is very structured meeting. When we are on the management part, we cannot jump there. For example, what does that mean? If they are going to ask you, while you are managing, okay, doc, what is the reason that I'm having that? If you have not explored the reason, how you are going to tell that reason to the patient? Okay, so we are going towards that follow-up visit. These 4 questions. Otherwise, rest of it will be like the first presentation. You are going to ask other questions. Okay, let's come to the first presentation. So what you will be asked, what brought you here today, or how can I help you? Whenever the patient is saying anything, she say, okay, I'm having abdominal pain, always ask a open-ended question. Why it is important to ask this open-ended question? Because the patient will tell you a lot of things by himself. You need not to ask so many questions. For example, if I ask you, what has brought you here today? You'd say, like, I'm having like abdominal pain. I ask, okay, can you please tell me more about your pain? Then the patient can start, okay, doc, actually, I have started, the pain has started like 2 days ago, and when I was doing exercise, and the pain was like going backward. Okay, look how many information he gave only just because of one question. I will just ask, can you tell me more about that? So this question is mandatory after exploring the HOPI. After starting your HOPI, first question is, can you please tell me more about that? So that should be in your mind. The first question, can you please tell me more about? After that, just watch. I have written complete Stupa, KRS, or TUPA. What is that? I am going to explain that. Why I have written complete? Because the information patient has already told you on this question, you are not going to ask again and again, because you are going to save your time. And otherwise, if you are going to ask a question again and again, this will like lower your marks as well, and it will lower your time as well, and you will lose your marks in the management part as well, because you will not have enough time to tell about the management. So complete the Stupa. For completing the Stupa, what is Stupa KRS? It is equal to Socrates. I have not made the Socrates my part because it's quite easy for you to learn the Socrates. You are going to learn Stupa KRS in few days, in 2 days, 3 days. But this sequence which we have made, that comes in mind very quickly. For example, where exactly the pain is? As for site, where exactly the pain is? Can you please show me with your finger? When did it start? T, time. Onset, 2 questions. What were you doing when it started? Was that gradual or sudden in onset? 2O. P, it has been continuous or did it stop after some time? Another progression. Has it worsened, got better, or stayed the same? Again, the progression. 2 questions regarding the progression, and 2 are different questions because both give you different information. Similarly, anything make it worse or anything make it better. You can ask two questions separately, but I have put it with the one, that is A. It is because I have made them, because when you are going to ask about the pain symptom, these are going to be the question. But however, whenever there is a non-pain symptom, you are going to ask only TOOPA, TOOPA. Because the mnemonic is same, the sequence is same. If we learn one sequence, the other sequence will be learned automatically. So that is why I have changed the universal kind of Odipara and Socrates, because Odipara comes in your mind, Socrates comes in your mind, but never ever this sequence comes in your mind. So we want actually in exam to be the sequence that should comes in your mind, not the, so you will not be needing after like 15 days, you will not be needing Stupa KRS or Tupa mnemonic or you will only have in your mind this sequence. Because whenever I ask this question, the next question comes should in my mind should the onset. After completing the onset, it should be the progression. Then worsen are. I hope you are getting my point, because these has to be in your reflexes. Not, it is not about the mnemonic. Mnemonic is just for the initial stages. It is because when you will start your conversation, what people do? People will keep on memorizing in their mind. Hello, what has brought you here? How when did it start? Okay, then people say okay, and by saying this okay, you are just buying your time. You need not to tell it. And sometimes you are repeating what patient says. Okay, the pain was going back in your mind, and you are just buying your time. So we need not to buy our time. We need to learn these by heart, so that we can do that quickly, so that nothing should miss. Otherwise, if you do this history station, most of the people take 6 to 7 minutes in just completing their history. So we have to complete in 4 minutes. For that, we need to have the brisk reflexes. That's why I have made this mnemonic for you, so that your reflexes should be quite brisk. Then what kind of pain it was? Does the pain go anywhere else? Could you please score the pain for me from 1 to 10, 1 being no pain and 10 being the maximum pain? These are the questions you need to learn by heart, because at least in your 5 stations to 6 stations, these questions are going to be must. 5 to 6 stations. Okay, so learn these by heart, work on it. Then there comes the other approach, non-pain symptom. Similarly, the non-pain symptom, I just picked these one. Okay, look at this. These one. TOOPA, TOOPA. So Stupa KRS, say TOOPA. Okay, so these are non-pain. Same. You are going to miss nothing if you are going to ask these. Okay. After asking that you will ask another question. This is quite important. Patient say I have a pain. You ask Stupa KRS of pain, and you will, after completing that, you will ask, do you have anything else? Until patient says no, you will keep on asking anything else. Say okay, nausea. Then you will do smart TOOPA of smart TOOPA, because this is not pain. You say have shortness of breath. Smart TOOPA, 2 to 3 questions or 4 questions. Just then again anything else. Then again anything else. If even the 4th time you have to ask anything else, ask him. Otherwise you are going to miss something. Okay, patient say no. Then it's your turn. First it was like, and on anything else you have been asking to the patient, exploring the patient. No, it is your turn. Okay, the patient is not knowing everything, so I need to ask a few questions. So then comes the DD. Until yet you have not reached the DD. So after doing Stupa KRS or TOOPA, you will be reaching on the point that is DD. After doing that completely, no, it comes the DD in your mind. So I have divided the DD into 2 as well. One is associated, rule in, suspected, and other is other possibilities like rule out. This is quite important you to learn, because then you will not miss anything. For example, if it was shortness of breath, so shortness of breath, or it was like chest pain. He says after chest pain, Stupa KRS, no, I don't have anything. Okay, you need to ask a few things regarding keeping it in. Like first thing comes in your mind is heart attack, because it was radiating, whatever the symptom it was having. So you will ask rule-in question. What was the rule-in question? It is actually DD. So what you will be asking, like any shortness of breath, any nausea, any vomiting. So these are ruling in. You are ruling in what am I? After doing that, then you will be ruling out. What are they? Pneumonia. You will be asking about fever. You will be asking about these things. Okay. You will be asking about pulmonary embolism. You will be asking about DVT. So these are you are ruling out. So let me tell you that after having complete grip on this approach, the thing which will be like worrying, wearing in most of the cases, that would be your DD. In the history taking, everything will stay the same. You will be asking the same question and you will just picking and choosing. Otherwise, the DD question will be remain on changing. For example, in the chest pain, DD will be remain more or less same. But if you go in the like headache, that will change completely. If you go anything else, that this part will change completely. You have to work very like intelligently on DD part. So keep in mind, always work on your DD the most. Other thing you are going to learn in 5 days or 6 days if you are going to practice this approach. But the DD part is quite important. Just not having DD in my mind. For example, if chest pain, I have to make the DDs in my mind. So DD should not be only in my mind. The question should be on my language as well. This is quite important because sometimes you have the DD in your mind. But for example, if the question in DD in my mind is pulmonary embolism, how am I going to ask the question about the pulmonary embolism? This is quite important. If I have the pneumonia in my mind, so these questions you need to work at as well. Okay, because you just not need only the DD in your mind. You have to have that questions in your head when and on your language. That is quite important. Other thing is red flags. So for the red flag, we have a very common mnemonic, that is flaw, that is universal mnemonic. I have not changed that mnemonic because what not needed. Flaw is, do you have any fever? And it was flaws, but I made it like, do you have any fever or night sweats? Sweats for night sweats. You have like made it with a fever. And this is not you are going to ask in every question. Therefore, we have to complete it, but not we are going to ask in every question. Red flag. Okay. And red flag could be sometime your like the symptoms, complications. These can be the red flag, but these are the very common red flag. These are the cancer. If no red flag is coming in your mind, the cancer is there. Do you have any fever or night sweats? Do you have any bump in your body? Do you have any decreased appetite, any weight loss? These 4 questions you are going to ask in the red flag. However, red flags can be in complication. For example, in MI patient, these are not the red flags. The red flags could be in the MI patient, should be the different one. Should be the patient, for example, the patient is having heart attack. The red flag could be shortness of breath is red flag, because it can have a complication of cardiac failure. Like on a lying down, shortness of breath is increasing, it can have a red flag. So red flag varies case to case, but our like if no red flag is coming in mind, because in the chronic cases, in most of the cases, the red flag is the cancer symptoms. Okay. Then comes I just going to just repeat this approach for you. HOPI. Till we have done the approach is HOPI. After presentation, the first thing was grips and presentation. Grips, after you have asked about the presentation, cause of presentation, then you have started taking your HOPI, history of presenting illness, in which we saw it is the first follow-up visit or the second follow-up visit. And then if the second, if it is a follow-up or the first visit, if it is a follow-up visit, we ask these 4 Qs. Then if it is the first presentation or even the second, then after we started after taking our history regarding complete our stupa or stupa KRS or stupa, and then we asked about anything else, then we completed our DD, then we completed our red flags. Till yet we have completed our HOPI, history of the presenting illness. The next question is the patient history. History and HOPI are 2 different things. Never mix them. I know you people are intelligent. You are not going to mix them. After taking the HOPI, now comes the next question: complete your history. History carries three things. One is past medical history, second is personal and social. I have kept them in under the one mnemonic, under the one umbrella. Why it is so? Because if I had to teach you separately, you like lose the fluency. When you are asking, like for example, if PMA Holy Family is like, it is past medical history, DISA RS, DISA RS, plus minus. I tell you why it is plus minus. DISA RS, this is a very common mnemonic, is used everywhere. And last one is totally. After completing one of them, people just wait for other to start. So we need not to have to wait. We just have in mind, because we have to start and we have to complete in a very coherent way. Similarly, the thing we had studied, that HOPI, in the HOPI, our questions should be in a coherent way. Trust me, these things are quite important for you. You are going to like do a lot of stations just with this one grip approach. Okay, then it comes towards the history. So first mnemonic is PMMA Holy Family. PMMA, MMA, PMMA, PMA. You can see P2M, PM2A or PMMA. Holy Family. Holy Family is a hospital. HOF. DISA. DESSARS. DISA RS. Totally. Okay. These are the questions you need to learn about that. Have you had similar problem in the past? The first question is that, have you had similar problem in the past medical? Past question about the same history. Second is the medical history. Do you have any long-term medical condition? Like, I have not put other things because you need to ask by yourself. Do you have any long-term medical condition like TB, SLE? When you are going to ask these kind of regarding to your, what diagnosis comes in your mind? For example, if it is MI, you are going to ask cardiovascular thing. You are going to ask, do you have any long-term medical condition like hypertension, diabetes? Okay, you are going to ask accordingly. You are going to ask like the things which are specific. Do you have any long-term medical condition? You need to ask questions. Okay, if she says, whenever she says one thing like, okay, I have hypertension, you have to change here your mind. Do not let it go. Okay, since how long are you taking your medication for that? Are you like up to date with your GP visits? You have to ask this question. Whenever there is a window open, you need to explore that window. Okay, what medication are you taking? You will be asking the medication. Are you taking them regularly? You are checking the compliance. Are you doing your routine medical checkup? You are asking everything regarding any medical condition. If he says, are you suffering from any long-term medical condition? She says, okay, like what? Or she say like what? Then you need to ask a few questions. Okay, like heart, like blood pressure, this and that. Otherwise, if she says yes, I am suffering from hypertension, you will start exploring the hypertension and medication. The next question is medication. Are you taking any over-the-counter medication or any regular medication? You need to ask both questions in it. Third thing, allergy. Are you allergic to any food and any medication, or having the history of any medication or blood transfusion? You need to ask them as well. So this is one question, allergy question. You need to be as much as information you want to ask, but this question is mandatory. Are you allergic to any medication or any food? You need to ask this. Other thing you can leave. Any hospital stay or surgery. H for hospital stay, O is for operation. How you will ask this? Any hospital stay or surgery. Then any family history. Has anyone in your family been diagnosed with any medical condition? And then you will be asking a particular question as well. And any long heart condition, any cancer condition. So this is like we have completed the social history till yet. Sometimes you ask very relevant question. No irrelevant question need to be asked in this part. Only the relevant thing. For example, if the patient is like on the MI, you will be asking these all questions. Similarly, this is DSRS is diet. Tell me about your diet. One question. Do you exercise physically? Again, this question is very much like typical. If you are asking a bedridden patient and you are asking, tell me about your physical exercise, then that means you are templated. You are not following. Okay, so these questions should be in your mind. When to ask, when not to ask is quite important, and they will not be asked in every case. So you will have to be selective, but just keep this approach in your mind. Just follow this approach initially, so that all these questions comes in mind quickly. And by after this question, this, then your mind will be trained. Then ask any kind of stress or sleep issues. Do you smoke? Again, if the person is smoking, you have to explore it. Since how long? How much? Again, alcohol. Do you drink? Do you drink? How much? Since how long? And if the person is like, in certain cases, the person says, okay, I've been drinking for so long, I've been drinking 1 bottle every day. That means he's not drinking socially. He is alcoholic. Alcoholism. Ask the question of alcoholism. Cage. We are going to study that in that scenario, but keep in mind, if there comes anything like that, that has the clinical significance, that has the social significance, you have to stay there. You need not to jump over there. For example, we stayed in the medicine portion when she said, I have hypertension. She says, okay, I'm drinking that much of alcohol. If she's drinking that much alcohol, you need to ask this question as well. By any chance, do you use the recreational drugs? For example, when we have to ask, we cannot ask this question. A person is saying, okay, I drink socially. A person is like 55-year-old saying, I drink socially sometime when I am with my family. You need not to ask that, do you use the recreational drug? A 55-year-old person who is sane. But if the person like is 20-year-old patient, he's saying like, I drink whenever I find the time, I'm in the party, I drink. So you need to ask this, by any chance, do you use the recreational drug? If he or she says yes, then another window is open. What is the window? What window is that? How much? What is your preferred route? Do you share the needle? Do you know about the needle exchange program? This is the same, the cage question. We wanted to assess his alcoholism. Here it is the same. We want to assess his his recreational drugs. But this question is very rarely asked. That's why I put plus or minus RS. And S is, you have to ask about the sex history. Whether the person is having the drug, it is mandatory almost. You have to ask about the sex history. How will you ask? I would like this is like, and you have to signpost here. That is your IPS skills. You have to, like, by any chance, you have signpost. By any chance, do you use the recreational drug? Similarly, I would like to ask a few questions, important question regarding your sexual life. You are signposting it. Is that all right? I will, whatever you will tell me, I will keep it confidential. Do you practice safe sex? Okay, how much partner do you have? These kind of questions you will learn in the counseling scenarios. These kind of a lot of questions will come there. But I want you to just have a know about that these kind of questions can be there. Then it comes TOLI. That is about social history. That was personal. Now it is the social history. Have you recently traveled abroad or took a long-term flight? You will not be asking this question, except TB patient, except like DVT patient. There can be other patient as well, like in the HIV patient. But this question is there. Trust me, there are certain scenarios they only can be picked, especially the HIV scenario, especially the TB scenario. There are other as well that can only be picked by this, and certain they are picked by the occupational history. What do you do for living? If you do not ask this question, he is not going to tell you I'm doing work in like shipyard, asbestosis exposure. If you do not ask, how you will tell that your condition can be due to this condition? You are not going to. So you need to have in your mind. Similarly, who do you live with? This is quite important. You can never skip it. Who do you live with? Why? Because whenever you are going to give some treatment, it has its own social implication. For example, the patient is living alone. You are saying that like somebody should help you, and you have not explained anything. Somebody should help you. Anybody is not living with him. How you are going to explain somebody should help you in that? So you need to ask this question. Does this condition impact your life and work? This is your IPS. Does this condition is impacting, especially in the chronic diseases, TB, like hypertension? You need to ask these questions. Just somebody is asking me. I need to share the postcode. I don't know. I have already shared that. Let me see. Let me check. But it is not the only thing you people need for the meeting, because everybody has joined with this. I don't know. I'm not very good at these things. So can anybody help me in that? Because why is the person is unable? Somebody has messaged in the group that she wants to he want to join. I don't know. I really don't know. Okay. Then after this, after doing this, completing this, then it comes ICE. It is quite important. I have made a little variation in it, that is AICE, because commonly ICE, it is said that you have to ask 3 questions. I don't find it appropriate. ICE. Why not? First of all, ICE is idea, C is particular concern, E for expectations. I don't know how to ask this question. What do you expect from me? Because he came with some queries and you need to solve it. So I, with my colleagues, we have made this conclusion that this question is not necessary. Instead, we have made AIs. Why AIs? Because this A will save you at many places. Is there anything else should I know? Or anything important we haven't talked about? For example, if you are taking history, the patient has not opened to some regard, and for example, you have not forget about asking the travel history. Maybe the examiner is kind to you. He will tell you, actually, I have traveled recently 2 weeks ago. So this question, instead of asking for the ICE, we will say AIC. Okay. Asking this, and do you have any idea what's going on? This is important. You should ask, do you have any idea? Do you have any idea what it could be, what your condition could be? You can ask any question regarding that. And then what are your particular concerns about? Sometimes this is quite important. You cannot leave this. You cannot leave the concern, because patient is giving you all the history, and in the end, he's giving you the history of IBS, and you have in your mind IBS. In the end, when you ask this question, what your concern? He says, actually, doc, I think I'm having cancer. Okay, then whole management in your mind should have a jump. Why? Because now the patient has told you he's having this, and this should be in your consultation. Otherwise, you are not going to pass this station. At least you are not going to get good marks regarding your management. Yeah, you are right, but I think you can ask, but whenever you are taking a so long history, you can ask this question: is there anything particular you are expecting from us? This is exactly about the concern. Whenever you are asking about the concern, you automatically have asked this question. If I ask you, what is your main queries? It has the same meaning if I ask you, is there anything particular you are expecting from us? Actually, if you go behind the sense, a sense is the same. We are just adding one question. If you want to add, there is no problem with that if somebody want to remain, but there are a lot of questions we need to ask on this, so we need to be smart in that. That's why I just want, but this question I want you to like install in your memory. Is there anything else we haven't talked about? It is important because actually this can save you some time. In some station, this can save you. Then comes the other part, last part of our data gathering is OET. OET is mnemonic. You will start with observation. O for observation. I would like to check your observation, including your blood pressure, heart rate, temperature, and breathing, and ask in that flow. Just repeat it by again and again and ask in this flow. We cannot kill our time here. So we have to ask in a flow, very good flow. I would like to check your observation, including your blood pressure, pulse rate, heart rate, temperature, and breathing. I would like to do your general physical examination. And why I have put the specific examination, that you have to mention the specific examination. For example, if you want to say in the patient ENT examination with is having a hearing problem, you will say, I will like to do your general physical examination of your ear. I would like to do general physical examination, your rectal examination, for example, if it is the case. So always mention the specific examination. For example, I need to take your blood pressure in the sitting and standing position in the postural hypotension. If you do not ask this question, you are not going to give you the reading. Trust me, in my exam, I want to tell you, there was a question, actually that was with, it was not postural hypotension, though I predicted it to be hypotension. I passed this with the 9th grade, 9 marks. Even I did not know about that thing, because it was oxybutylene that caused dizziness. So I thought it is due to postural hypotension. And when I asked the patient, okay, I would like to take your blood pressure in sitting and standing position, it was normal value. Even though I did not know about, but they gave it a grace and they gave me good marks. 9 marks are but the good marks in that station. Then of course I told I need to further more testing, but you need to be specific on this as well. You need not just say, okay, I need to take your observation, I need to do your general physical examination. No, this is not the way. You have to say that, along with that being specific, which you have assessed in your clinical gathering, data gathering. Okay, I would like to do some tests. This is again quite important. You have to be specific. Bedside test, you cannot say, I'm going to run some MRI, I'm going to run some echo. You cannot say that. But you can say, I need to do your ECG, I need to do your chest X-ray, I need to take blood sample from the CBC, for the marker. You can do that. The bedside test, you need to say that. Okay. Till here we have talked about is the data gathering. This should not be more than the 4 minute, max 5 minutes. You have to do such a practice that it should be less than 5 minutes. 5 minutes is the upper value, because you need 3 minutes at least for the management. Okay, so here comes the other part which I haven't talked about yet. It is the data gathering. It is IPS skills. Yes, these tests comes first, because, for example, if you have to do MI patient, you will do ECG. Of course, you will do ECG. Then the patient came with chest pain. The bedside test you will do. Urine dipstick you will do before. Pregnancy test you will do before. Any test that is under your domain, and that is the bedside test, you will do here, because that will support your diagnosis, and that is the quickest method to do that. Because you can do ECG, you can send for troponin, you can send for. Okay, so do that at same place which I have talked before disclosing the diagnosis, because sometimes you will do the test, they will give you the value. I will do the urine dipstick. Okay, they will give you some esterase positive. They can say that there are cells present over there, so that will strengthen your diagnosis, and that is quite important. That is still, I know I am just breaking your flow, because after this you need to disclose the diagnosis, but this disclosing the diagnosis is the part of management. So before I tell you a few points regarding your IPS skill over here, we need, then we will, because the IPS has to be go by and by in whole of your station. So better we talk on the IPS skills here. First of all, it is like same grips is your IPS. We have talked about already. Picking the patient verbal and non-verbal clues. The patient is sitting in a particular way. It is the verbal or non-verbal. For example, if the patient, like a female, is sitting like this, exactly like this. I have seen in my exam, literally, The patient was sitting like this. Okay, you go but you will assess in your mind. There is something like going worry on it, and you need to be very gentle. You need to be very like very calm, like dealing with that. So picking up the verbal and non-verbal clues. Okay. Then address the acute symptom. For example, if you go and patient says, okay, doc, I'm having a lot of pain in my chest, doc, actually I can't breathe. So what is important for you? Just to ask, okay, hello, Mr. Matthew, should I give you the painkiller so that we can talk about later? So be with the patient. If the you cannot say, patient say, oh, doc, I'm having chest pain, and you say, hello, my name is Dr. Hamid. This is illogical. So you have to be with the patient. What patient is saying, address his acute symptom, acute concern. Acute concern is, I'm having chest pain. Okay, I'm having shortness of breath. I can't breathe. So what come in your mind? Okay, I need to check your oxygen. If you're needing oxygen, I can give you the oxygen. So this is IPS. IPS is not just to be good. IPS is do everything according to the situation. That is IPS. Okay, provide the emotional support whenever there's need. He says like, actually, doc, I'm feeling low. My father died 6 months ago. You say, you forget about the father and you start asking, okay, tell me more about symptoms. Okay, you need to be empathetic. You need to ask, okay, Mr. Matthew, I'm really sorry to hear about your loss. That must be very stressful for you. You need to be empathetic. And for that, you need certain sentences to be empathetic and do the emotional support. Keep the patient comfortable. That is quite, again, important. You have picked some clue. Until the patient is not comfortable, don't hurry in starting your conversation. For example, patient is saying, doc, I don't know how to tell you. Make the patient comfortable. What you need to say is, okay, John, look, I'm your doctor. Whatever we will be talking here will be remain between you and my team. Don't worry about it. Nobody is going to know about that. So you are trying to keeping the patient in a comfortable zone. Do whatever is required to keep the patient in comfortable zone, and this will be in this part. Okay, non-judgmental speech. This is again quite important. Never say from my assessment, you seem to me alcoholic. Do not say that. Never be judgmental in any way. No judgmental speech should be there. Okay, I can understand that your husband is alcoholic. Never say that. You cannot be judgmental, especially in the LGBT scenarios. You can never be judgmental. Okay, this is more, Dr. Adil has this part counseling, and he has very full grip on this. He's going to talk about that. Listening and paying full attention to the patient concern. This is one of the reason I am going to tell in the end, the people fail. This is the one of the most common reason. So never do that. If the patient says that this is red, it is red. So consider it is red. If the patient says it is black, even you are watching it, it is blue. Say it is black, but my opinion is that. Okay, don't say no. This can't be black. Say, okay, I can see that you think that. What made you to think that? You just be empathetic and talk to the patient and listen to the patient. Trust me, even the smallest thing the patient says and you just ignore, and that will make you templated. This, what we are talking about, is approach. This is not templated. Templated is that when the patient says something and you don't listen, you just want to tell, and your time is just going and you want to tell something. This is template. This is approach. You are going, you're following your steps. This is approach. And the patient is saying something. Meanwhile, you are not doing anything. You are not paying attention. You are not listening. You are just wanting to tell your management. This is where we are the wrong. Patient-centered consultation. This is the same. These both have the same. You listen and talk. Listen and talk. Wherever the patient wants, okay, my concern is this. Even you are taking the history. Patient says, my concern is this. Explore the concern. That's it. That's your IPS. Trust me, if you are just keep in your mind these questions of IPS, that you are going to do brilliant in your history taking scenario, in every scenario. Okay. Now we come the other part. That is not the bigger part, that is the smaller part. Okay, and but I am going to discuss it with you because this is the part which is most of student have low score. You can if on your student like your colleagues have taken this part of the exam, you will see the management part is always weak. It is because of the two reasons I have what we have discussed in our team. One reason is you find your time short because you have spent like 6 minutes in your all the other conversation, and then when you come to the management, it though the management carries equal 4 marks, data gathering carrying equal 4 marks, IPS is equal 4 marks. Okay, and whenever you find low time, you cannot do your IPS in the management. You cannot tell the patient which need to be told. Again, you will lose your marks. One is problem is with your time. Second thing, equally important, you want to tell everything. What I have learned, I want to tell you. Whether you want to listen me or not, I am going to tell you. So that thing is in our mind. Okay, because I have read that, that is why I need to like put in your mind. Whether you believe me or not, I am going to put it in your mind. These are the two things which makes our management weak. For the making your management strong, only two strategies are needed. You just adapt these strategies throughout your now practice. You will see it quite easily. First of all, based on the history, observation, examination, investigation, disclose the diagnosis. I will pick and choose. As you told me that you were having shortness of breath and you have traveled abroad recently and you have a history of TB regarding your mother-in-law, whatever. So I suspect that you are suffering from a condition that is called TB. This is the way to disclose. For example, if there is some examination finding, there are some history finding, you will pick and tell that this will carry 1 mark to you. Just this will carry, because by this you have involved the patient. This will only telling in this way will carry 1 mark to you, because first of all, this will tell the patient, this will tell the examiner that you have not mugged this up, you have not learned this by heart, because you have taken the history, and now what you are telling is based on your clinical judgment, not on what you have learned by heart. So this is quite important, disclosing the diagnosis by picking few clues and telling. This is important. Okay. The second thing that is quite important, that is telling your decision. Telling your decision abruptly after disclosing the diagnosis is quite important. The patient going to ask, okay, but you are going to do, even whether it's asking or not asking, after if the patient is close, you are going to tell your decision. What can be the decision? Immediate admission, symptomatic treatment, referral, immediate referral, it can be referral, routine referral, it can be urgent referral. You should know about the difference. Immediate referral is right now, MI, right now. Suicidal thought, right now. Just we cannot wait. Just even you will say, okay, I will arrange an ambulance for you. You will not say to the suicidal patient that, okay, you need to be transferred right away. You should go. No, you will say, okay, I am going to arrange an ambulance for you, and a staff member is going to accompany you. Okay, because that is dangerous. Similarly, urgent referral, suspected cancer approach. In that urgent referral, within 2 weeks, what I suspect that you are having colorectal cancer. What that can be another condition. However, we need to send you. We need to refer you to a colorectal surgeon so that he can assess you. Okay, this is urgent referral. Routine referral. Okay, 6-week referral. That is 6 week, 2 week referral, immediate, urgent, and routine. So there are different kind of referral you will learn by in each and every scenario. Okay, then comes the senior involvement. This can be a part of your decision. Okay, I'm going to admit you and I'm going to involve the senior. I'm going to admit you and I'm going to give you initial treatment. Okay, then it can be sent home. You can be, everything is normal. Go your home. Nothing is going wrong. Okay, I'm going to do the safety netting if this is wrong. So after disclosing, you are going to tell the patient your decision. So decision can be any of them. Then come the targeted management. Targeted management is a lot of things are in it. It can be any special test. It can be special treatment. For example, what can be these special tests can be echocardiography, CT, MRI, These are special tests which are required. These are beyond your scope, but your senior can order, but you can tell the patient about that targeted management. And then you need the special treatment means, okay, acute MI, we have seen, we have given the monotherapy, we have given the painkiller, we have given the everything. Okay, now we need to check the cholesterol level. This is the special test, not routine test. We do not do to every person. We need echocardiography, the cardiac, we are going to see the cardiac. Other thing, okay, and the special treatment, statins, you can put it on statin, you can put on beta blockers. So these are special target tests. Trust me, these are not important. These are not what we think. We think as a student, we think this is the most important thing. If I don't know about this, trust me, if you don't know about this, you are going to pass your station. But if you don't know about these two, you cannot attain good score in your management. These two, disclosure and your initial management. Disclosure and your decision is quite important. This is not important. This is not that important, but of course it carries its marks. You are going to tell the patient because patient have some concern, you are going to address them, but this is not going to fill your station. This you can say, okay, he's going to ask what they're going. I do not know exactly, but as a junior doctor, I can tell you that they are going to run some special investigations. Even you don't know about the name of this investigation, they are going to get it that you are FY2. It is possible that you don't know about it, but it is not possible that you do not know about this and they are going to like can give it away. No way. Okay, then it is again the long-term management is again important here. Why it is important? Because you are on the GP, you have to send many patients on the lifestyle modification, prevention, therapy, like everything, or safety netting. Never forget about that. 70% of the cases carries in safety netting. Everything carries safety netting. So do the safety netting. Then offer the leaflets, and again ask anything remaining. Anything remaining you want to ask. Because you are again making. Meanwhile, this is all about the management. Just keep these headings in your mind and start preparing your management. Start preparing your management to everything. You will learn that this approach will fit everything in it. Okay. Then again, the IPS start disclosing of the diagnosis, immediate addressal of the acuteness. What was the acuteness? SOB. And what you did giving, that is important. You cannot jump to the target therapy leaving the initial acute management. Immediate decision, you need to tell the immediate decision. Involving the patient. In whole this scenario, you need to keep the patient involved. Because in the history section, you will involve the patient, it is by default. But here, you would have to check the patient attention. You will have to checking his understanding and agreement. Does the patient is agreeing with you, or you are standing at and saying, no, patient is making faces. No, I can't do that. So you need to check the agreement. You are telling the story. Actually, what you have got is a acute myocardial infarction. So we need to admit you in the hospital, and I'm going to give you the monotherapy that will include oxygen, that include this and that, and after that we are going to consult with the senior. And after that, when you will have 1 minute time in the management, you will sing a song like this I'm singing. You will not tell the management, you will not involve the patient. However, when you have the 3 minute or 4 minute, then you will be calm and you will be saying, okay, tell me that what if before sending home, what if I send you home? However, if you find anything like uneven, like any shortness of breath, any fever, you need to consult, you need to call on 999. Okay, you are doing the safety netting, and I want you to stop smoking. Have you ever tried stop smoking? Okay, this is you have like talking to the patient. So here your mod should be talking to the patient, not dictating the patient, because it is not the examiner that want to know about how much you know about that. They want to know how you tackle your patient. Not they have the knowledge. We are not giving them the knowledge. They have enough knowledge, and the books have enough knowledge. They just want to check our approach, because with the knowledge we can make our approach, but they are going to judge the approach. It is not I'm saying that you do not need any knowledge. This is, I don't know from where it comes in the plab to learner that the knowledge is not important. Knowledge is equally important, but they are not going to check your knowledge directly. They are going to check your knowledge indirectly through your approaches. Okay. Again, keeping the patient comfortable. We have talked about that. Emotional support, patient-centered consultation. We have talked about that before as well. The things will going to stay same. The important thing was to address the immediate concern, or addressing the patient concern, checking his understanding and agreement. This point is quite important here. This is quite separate. Okay. In the end, you ask about anything we haven't talked about in your conversation exactly, or then you will answer the patient questions here, and then you will say thank you for your compression and may you have a speedy recovery, and you will end your session. Okay. This is all about the station. Okay. After that, we have talked about IPS and these things. I tried to teach you in a parallel fashion. Then there comes the most common deficiencies in approaches. I'm going to talk about because my charging is getting low. So I'm just coming back, and in 2 minutes, my charging is actually coming low.
इतनी मनहूस है ना फरा यार, इतनी तो मनहूस हो। मैं अभी थोड़ी देर में सोच रहा था यार, कोई चीज मैंने नहीं की, मतलब कोई काम है। मुझे याद आया है कि मैंने तुमसे बात नहीं की अभी तक। तुम्हारी बातों की वॉइस नोट की ना, ये बोलो लोग अकेले उठने, और अब ना वो आदत हो गई थी यार, कुछ कर रहा था तो तुम्हारा ये मैसेज आ गया। भाई कमेंट तो बेटा आपकी तस्वीरों पे अनिका मायरा भी करते हैं। निकालूं मैं इंस्टाग्राम आपका? हसीन
Hello guys, I'm back. Okay, let me inform you. Actually, I have been offered the job by in the Wales. Actually, in gastroenterology. I'm doing my documentation with them. Of course, we are going to have certain sessions on interview, how we have to prepare the interview, how to prepare the CV later on. Okay, come back. It was my second interview, and I luckily got the job. So they are asking me to come there in from the 1st February. Okay, the most common deficiencies in approach we are going to discuss by and by. Thank you very much. Thank you guys. The most common deficiencies in approaches. These are most common deficiencies. Taking disorganized history. When we take disorganized history, when this approach we have talked about is not learned by our heart, we will be asking questions randomly and we will be losing marks. Assuming diagnosis and leaving asking question. This is one of the common cause of failure. Just keep in mind, this is the second thing I'm telling you, the common cause of failure. Again, the thing which prove you to be scripted, that is the most common cause of failure. Anything like this, assuming, okay, I have asked question about DVT. I'm not ruling out the DVT or DDs, my DDs. How will I know? How will the examiner know that I know? Because you have left so many things. You have not ruled out the things. So this is one assuming. For example, most of the cases we have learned by heart. I know that everybody of us, in the end, there are 300 to 400 cases we learn by heart. But learning that is not bad. But assuming the diagnosis on, trust me, it is very common comment. the people who have taken the lab 2 exam, and they come and this was the perfect station what I did, but I failed. I don't know why. And they are like stucking their head with the wall. I don't know why this has happened. Why this has happened is your scripted approach, because approach is one thing. Going through your approach is one thing, and being scripted is one thing. Going with your approach is good, but being scripted is not good. Taking too long history, and taking too long history, why people take too long history? Because I have specially on this, actually I have specially put the points, because I know that this is 90% people, especially the people from Pakistan, take too long history. There are reasons behind that. One is irrelevant question. We ask so many irrelevant questions. Repetition. We do repetition. A patient told me that she's having the chest pain that was radiating to the back. I will ask according to my script. Okay, is there going anywhere else? This will deduct your marks in two ways. One, scripted, and second, it is like killing your time. Trying to buy the time while translating. This is also very, very much common, and the solution is the practice. There is no solution for that. Trust me. You have to, because I teach OET as well, so I make my student to learn a lot of phrases by heart. So learn all these questions, make your own question, but learn them by heart. You do not need to translate. Whenever you need to ask one question, that should come in your mind directly, not in Urdu or any other language. That should come directly in your mind. When I want to say, for example, when I want to say, where is the chest pain? So it should be, the concept should be clear. So how you need to learn these phrases by heart. Asking too long questions, again, asking too many questions and too long, make your question smart. Repeat the patient already information, asked to many questions to each DD. Okay, this is one thing. For example, if I want to rule out DDs, okay, I have already ruled in it is acute MI. So be smart. Ask only little question regarding DD, telling that it's not like you have any chest pain. For example, you have to rule out the pneumonia. Do you have any fever or any pain on forwarding while leaning forward? That's it. Do you have any inflammation like swelling of your leg? It is pulmonary embolism. Do you feel you need to ask? For example, if I ask about the question regarding let's suppose tiredness. If it is the tiredness, I have to ask a lot of questions. DDs. I cannot be asking a lot of questions regarding hypothyroidism, because hypothyroidism carrying 8 symptoms. Would I ask the 6 to 8 symptom? No, I will just be asking 1 or max 2 symptoms. That's it. I will be asking like, do you have any constipation? Do you feel cold when others feel normal? That's it. That's it. It's gone. Now to the next. Your mood is low. Okay, the mood low carries its own questions. We will not be asking too many questions. I have reiterated on this because people do that. Just ask 1 or 2 questions for it. That's it. So these are the ways we can enhance our history taking. These are the common mistake people do. Secondly, the management. Poor time. We have talked about that already. Unable to explain the diagnosis. You are not able. You are just saying from my assessment it is acute MI. No, just say this is the point you have already picked up. Just say that from my assessment I have seen this and that. That's why you are having this. Okay, say that. Trying to tell all the available knowledge without organizing steps. This is very much common, because for us the management part is failed. Second thing, because of this, actually they want to know about the steps and you want to tell about the actual management in the books. For example, if I remember the Davidson in my mind, we will see that when we were in the final year, they have told a lot of Davidson, and some people have read the Danish, Naam Danish, and they have even so long. These are not the steps. The steps is your approach. Okay, the patient come with atrial fibrillation. What is the step? What is the step? The first step is I will see the time. What time it is, I will anticoagulate. This is the step. The other thing, what I will do with it, what I will do is the secondary thing. The important thing is I will admit the patient, I will do this test, and I will give this. That's it. They want to know about your steps, not about the whole story. Okay. Lack of smart knowledge. Of course, this is staying the same. not able to address the patient concern. This is again the common, because you want to tell, but you know the patient is asking something else, and you are not telling the thing the patient want to ask. Sometimes you don't find time to know about the patient concern, then it is written in the exam in their question booklet that this question you need to ask, and they're not asking, they're not giving you the mark. So again, time management is again here important, and the patient-centered approach in unable to engage the patient in the management we have talked about in a very detail. Similarly, IPS unable to tackle the patient emotions, not showing empathy or doing appropriate trying on offering, such as offering the tissue. This is a question. I need to offer appropriate empathy, sympathy, whatever it was needing. For sometimes people do inappropriate steps on this, inappropriate emotions. For example, patient is not weeping. You have told that you are expecting that he should weep, because I'm telling your father is in a terminal state. The patient is not weeping, and you are offering the tissue paper, and you are offering the glass of water. The patient is not weeping, and you are offering both things simultaneously. These are the inappropriate things. Like if you know, in your general life, what do you do as a good human being? These are the things what you will listen. The patient is angry, the patient is talking. Okay, the patient is talking and talking and talking, and you are talking, you start talking as well. This is the inappropriateness. You will listen. The answer is you will listen. The patient is angry, you will listen. The patient is weeping, you will not stop him weeping. You will wait. Still, he give you some gesture like, is it he's doing that, and you will not stop him weeping. You will just offer, okay. When he stop, and you will offer him, okay. If he's weeping, then you will offer the tissue paper. Okay. So be appropriate and show your empathy appropriately. Speaking heavy sentences without having genuine facial expression. This is again very common, because whatever we want to express, actually, you are saying very in the mask face. You have the mask face. I have, for example, you are saying, I'm really sorry to hear about your father. That must be very stressful for you. This is mask face. You are not showing any expression. So you should show your emotions. Be actor. Be a good actor. So be a good actor here. Ignoring the patient concern, not listening to the patient, not making eye contact.
तू मेरे नाल पीछे वापस आना पे है, मैं तां अंदर आने वेख्या।
Just a minute. ये किसी का माइक ऑन है, प्लीज इसको। ओके। Similarly, आपको ये वो वाली चीजें हैं. These are the things you need to keep in consideration. Other thing is follow the myth that exam need only practice. No, it is not. You need to have the knowledge and you need to have the practice both. So clear your myth today. This is not the case. You have to practice and you have to have the knowledge about it. Not having sufficient knowledge of the particular approach. This is one of. Okay. Again, last thing, scripted. This is the most common cause of failure. So keep in mind, you do not have to be the scripted. Poor score in the management domain and exam anxiety. These are the three things, only three things. If you have to tackle, you will not fail this exam. Okay. Now we will come towards our practical station, which we because I have been working on this because I want this approach to be the perfect one. Actually, regarding the practical scenarios I have today, we are going to talk about. I need your involvement now in this regard, because your involvement is quite important for us. Because if your involvement is there, then you will be learning a lot. Okay, so for example, we are here taking an example of chest pain. Okay, I can repeat it for you, no problem. Grips is This is grips. Grips is greet, repo, introduction, purpose or paraphrase, and smile. These are 4 things. Actually, because we have put a lot of time on this, you should go and you will watch the video. It is there. You can see, because otherwise I have almost taken 15 minutes explaining that. I cannot explain you in that a good way. That is already explained. You can see that. Okay, we are going to share our video otherwise. Okay, better, so that we can start our practical scenario. And I want your involvement. You people should get involved in this. Then you are going to learn a lot. Okay, so regarding the chest pain, the first how we are going to tackle the medicine scenario. I'm going to give you, I have given you the description. This is by the symptom. We are not going to run by the systems. We are going to go by our symptoms, not by the system. Why? Because in real exam, if the patient says I'm having chest pain, if the patient says I'm having tiredness, you don't know about which system he is talking about. He's talking about the endocrinology. He is talking about the anemia. He's talking about like the any condition, any other condition. So we are going to learn our approach by the system. So today we take an example of chest pain. The chest pain is our example. Chest pain, the scenario which we cover are acute chest pain. Please keep your mics muted, because creating disturbance. Okay. So first thing in our yes, I have already muted, but yes, I think I should mute everyone, but I don't know from how can I mute. Sorry, I don't know how to mute. Later on I will learn, and in the next session we will be doing that. Okay, the question is here, chest pain. We are going to discuss this case. This is the scenario. For example, you are FY2 in emergency department. Mr. John Smith, age 49, presented with to the hospital with chest pain. Only sometime it is written the patient has come with some concern. Nothing has told you. Just say outside your dormitory, outside your station, it is written the patient came. Most of the time it is there. It is not like this. It is written the chest pain. It is a come with some concern. Okay. So how you have to approach? If the says come with some concern, or it can say come with chest pain. When it comes with say chest pain, what should be in your mind? DDs. What should be in your mind? DDs. But if it is saying nothing, you should like 1.5 minutes waiting outside. What you should like at the time, what you be doing? You should be learning his name. Mr. John Smith, Mr. John Smith, Mr. John Smith, 49, Mr. John Smith, emergency. You should be repeating that, so that while doing conversation, it is very good that you are addressing the patient with name again and again, because it carries good marks in your IPS. So learn outside, you learn this. Okay, if it is the case, for example, patient is age 49, presenting with chest pain, talk to the patient, take history, assess the patient. This is common everywhere. So okay, come forward. How we will be doing that? I have started preparing that lectures for you. It is taking a lot of work. Honestly speaking, the going work I'm presenting you, it took me almost 5 to 8 hours total. In 8 hours total, because there is no if you people have some good notes, anybody can transfer me. I can make a very good. I have not seen a very well approach notes till yet, in which I can give you, I can say you, okay, for that what I'm going to do is I'm going to make these notes by and by. Honestly speaking, in the next lecture, because today I was working on the approach more, I could not like make a lot of notes of stations for you. So, but we are going to discuss here about the stations. Okay, the patient information is central chest pain. They are not going to give you. I'm just for your practice. For example, if you have to practice between yourself, the other patient will learn about this thing. For example, if you are the doctor, I'm the patient, I have to be the patient. What I will, central chest pain, 2 hours was sudden, in onset, continuous, and all that. Because you need to explore me. And what while doing that, you will be like asking all that approach we have been discussing, starting from initial what brought you here, after doing all that mnemonics we have talked about. After doing that, you will be doing that. I'm not going to write that again and again, because these are the same. So what I'm going to write is about the DD. Drooling, sweating, breathlessness, and nausea. For example, if you are asking a question, the person is stating sudden in onset, continuous, was started suddenly. It was like somebody sitting on the chest, was going to the left jaw, getting better now, 7 out of 10. His dad had the heart attack as he was 50-year-old, smoked 20 cigarettes, do not eat healthy, do not have much time to exercise. Okay, anybody of you, I want you people, I will be the patient, and I want anybody of you do this approach with me. Trust me, this is the way you will learn a lot. You will learn really a lot. Please volunteer somebody who the information is given here. I have told all the thing, and even if you make some mistake, you make some error, doesn't matter. You will learn a lot. And even somebody is making error, the other person will learn a lot as well. Okay, good. Zainab, okay, chale, I'm glad somebody in our squad is like brave enough. Okay, Zainab, just open your mic.
Yes, sir.
And you just read this information and not other information. And you have 1 minute. You can make your mind, make your plan. 1 minute.
Okay. For the patient. Okay, I think I'm ready.
Okay, great. Okay, you can start.
Hello, how are you doing?
I'm good, thank you.
Okay, so my name is Dr. Zainab. I'm one of the FY2s in GP surgery here. Could you please tell me your good name?
I'm John Smith.
Okay, is it fine by you if I call you Mr. John?
Yeah, you can call me. You can call me better Johns.
Okay, okay. So John, can you please tell me what has brought you to the hospital today?
Actually, doc, for the last 2 hours, I'm having the chest pain, the pain that is like related to my jaw and to my.
Hello,
Yeah,
can you hear me?
yeah, I can hear you.
Okay. So, Johns, I would like to ask you a few questions about your symptoms, just to be sure about your condition. Is that fine by you?
Yeah, sure.
Okay. So, can you tell me where exactly your pain is? Can you point your finger towards it?
Yeah, it's on the left side. This on my chest on the left side.
Okay. And just like you told me, it has been there for 2 hours, right?
Yeah.
Okay. Did it start suddenly?
Yeah, actually started suddenly.
Okay. And what were you doing when it started?
I was just sitting watching TV and it started.
You were not doing anything, any exertion or exercise, right?
No, really not.
Okay. So for how long did the pain last? Was it continuous?
Actually, it's for the last 2 hours. Now it is a bit better, but it's continuous, but it's better now.
Okay, so you have been experiencing the pain for the last 2 hours, right?
Yeah.
Okay. And is there anything that has made the pain better or made it worse?
It's nothing is making it better or worse. It's just getting better on its own. I have not taken anything.
Okay. Can you please tell me that what kind of pain it is?
It's like somebody is sitting on my chest.
Mm-hmm. Okay. And does the pain go anywhere?
Yeah, it's going on. I told you, doc, it's going on my on my jaw and left arm.
Okay. Okay. So, Johns, could you please score the pain for me, like out of 1 to 10, where 1 being zero pain and 10 being the maximum pain for you?
It was a lot. It was 7, but now I think it's 6.
Okay, that's good. So, is there anything else that you would like me to know about your pain?
Like what? No, I have told you everything regarding the pain.
Okay, so so Johns, do you have any associated shortness of breath?
No, really not.
Mm-hmm. And have you recently traveled or took a long flight?
No,
Okay, so did you experience any sweating while you were having the pain?
no, really not. I didn't felt anything like that.
Do you have any cough or any chest pain that is exaggerated with movement?
No,
Okay, so I'd like to ask a few more questions just to be sure. Is that fine by you?
sure.
Okay, so do you have any fever or night sweats?
No,
Okay, so have you had any similar episodes in the past?
no. This is the first time.
Okay, do you take any long-term, do you have any long-term medical condition, anything like diabetes or hypertension?
Yeah, I'm known for diabetes.
Okay, and for how long do you have your diabetes?
Almost for the last 6 years.
Okay, and is it well controlled?
Yeah, it is controlled. I try to be compliant with the things doctor tell me.
Okay, what do you take for your diabetes? Is it controlled with diet or do you take any medications for it?
Yeah, I take medication, some oral medications.
Okay, do you remember the names?
No, really not.
Okay, no issues. So, is there anything else or any other medication that you take on a regular basis?
No, I do not take any of them. It's the one, just one medication I take.
Okay. Do you have any allergies to any food or any other medication?
No, really not.
Okay. And have you ever been hospitalized?
No, never.
Did you undergo any surgical procedures?
No.
Okay. And could you please tell me about your family history? Is there anything in particular?
Yeah, and actually, I have a family history, and my dad had a heart attack when he was 50 years old.
Oh, okay. And did he had any medical condition also?
No, just he had this heart attack.
Okay. And could you please tell me about your diet?
I eat everything. 2 minutes remaining.
Do you do any physical exercise?
No, I don't find time for that because I'm a lot of job stress.
Okay. Okay. So I see that your job is stressful for you, right? So do you smoke?
Yeah, I smoke, but I smoke almost 20 cigarettes per day for the last 5 years.
Okay. And by any chance, do you drink as well?
Occasionally, yeah, I drink socially.
Okay. Sorry, I could not hear you properly. What did you say?
Yeah, I drink socially.
Socially, all right. And okay. Is there anything else I should know?
Yeah, nothing. You have asked us so many questions. Doc, actually, I'm worried. That's what's going on with me. Is I'm having heart attack?
Don't worry, Johns. I'll be talking in detail about your condition. It was just mandatory for me to ask you these questions just to be sure about the diagnosis, so that I might not misguide you or we do not miss anything important. All right.
Okay, fine. That's totally fine. No problem.
All right. Okay. So now I would like to check your observations, including your blood pressure, your pulse rate, and your respiratory rate, your temperature.
Okay.
And I would like to do your examination, including your general physical examination. And specifically, I would like to examine your chest. I would like to auscultate your heart.
Okay.
And I will be maintaining your privacy throughout the period. And I will also provide you with a chaperone. If you find any discomfort, please let me know. I will stop right away.
Okay.
And I would also like to run some.
Oh, carry on. Carry on.
Sorry.
Carry on.
I would also like to run some tests, like I would like to do your ECG right away and send some blood tests like cardiac enzymes and some baselines blood tests.
ECG is normal.
Sorry, what did you say?
ECG is normal. Like finding is given to you. ECG is normal.
Okay, so Johns, I can see that your ECG is showing normal cardiac rate and rhythm, but depending upon what you told me, like you came to me with short history of chest pain that was sudden and very excruciating, and it was radiating. It made me believe that you had a condition, and further upon examining your chest, there was nothing particular on your examination, and all your ECG is also fine. But I have a strong belief that you could possibly have a heart attack. And
Okay, doc.
to be sure about.
What you're going to do for me?
Okay, because your ECG is fine right now, and it is very likely in certain people and in certain scenarios for the ECG to be fine.
Okay, but what you are going to do with it for me, doc?
I would like to send some blood tests for cardiac enzymes and do some specific investigations for you and involve my seniors about that as well.
Okay.
And if we find anything related to your heart or anything about that, we would like to involve a cardiologist as well.
Okay.
And right now, I would like to give you the routine regime that we give to the patients that we suspect for angina or a heart attack.
Okay, what is that?
Okay, I would like to give you some aspirin and a medication called clopidogrel. These are blood thinners that will help your blood to not clot and do not cause any more dysfunctioning with your heart.
Okay, that's fine. That's fine. No, you are going to
Am
keep
I clear
me.
so far?
You are clear, but I'm not clear that you are going to admit me or going to send me home.
Okay, Johns, I would like to admit you for the while, and just like I told you, I would like to run some tests and involve my seniors and ask about their opinion as well. For the time being, we make a diagnosis for sure. We would like to keep you admitted.
Okay, that's fine.
Okay, so Johns, I would like to give you certain lifestyle modifications before we end our conversation. Would you like some?
Yeah, doc, you can tell me that what lifestyle you want me to.
Okay, so you just told me that you smoke and you have a lot of stress, right?
Yeah.
Okay, so have you ever tried to quit smoking?
Never.
Never. Do you plan on doing so?
No, I like smoking.
But okay, that is your personal choice. But being your doctor and keeping your health as my first priority, I would strongly recommend that you should try to stop it, because it is of course it is impacting your health.
Okay, doc, I will think about it. Don't worry.
Okay, if you ever make up a mind, will please let us know. We can give you all the information about how to do it. We have smoking cessation clinics, and we can help you with that as well. Furthermore, I would like to talk about your dietary habits and your physical activity. Like you told me, you have a lot of stress at your job and you do not find any time for any exercise or activity. So, is it possible for you to just if you do you take a bus on your way back home?
Uh, no, the doc are fine. I will keep. Okay, Zainab, it's enough. It's sufficient because
Okay.
I actually this approach is in another stations. These are the counseling stations. So you
Okay.
people are going to do that in a very good approach over there. And this because it's otherwise it's going to mix the approach, because I want you to learn the thing which are specific to this station. You are talking very rightful things, but these are other approach.
Okay.
We are going to talk in the
Okay.
counseling stations, that thing. Okay.
Okay. Okay.
Okay,
You can ask me
everybody.
about.
I want everybody to give your opinion in the writing. And Zainab, you tell me what you tell me about yourself, how it was.
I was recalling stuff in my
What
mind.
were your stronghold and what was your, like, you should improve in things?
I need to have a stronger grip on the Stupa, KRS, and PMA Holi, because I think I was because obviously I was doing it for the first time and I was recalling the questions.
Okay.
I was not so spontaneous about it, and furthermore, I think I should have been a little more faster and during the history taking.
Yeah, I pointed that you also said GP because it was acute emergency. I told you that this is very common mistake. People go and people say GP because it is acute emergency. So you should say.
Yes, I said GP surgery.
Yeah.
Hmm.
Yeah, repetition of question was there. Repetition of question, lot of repetition of question. Even when you were asking, you asked 3 times, and I told you clearly. Then actually your case was a very prototype which we Pakistani when I was preparing, I was doing the same. Honestly speaking, I was doing exactly the same thing you have done. That means 90% of us are like in doing this station. We are carbon copy of each other. Okay. So, okay, one thing Dr. Khubab is telling that, and he's one of the things she can improve knowledge of, she can knowledging the emotion exactly. When her patient, when it was told to you that his father was having MI, you should have been empathetic over that, and somewhere else. When the John told you about the pain, should you stop? Console him. You can even ask him, you are comfortable in talking. Yeah, you could have done that as well, because he was saying
I said oh spontaneously, and then I was like, oh, I cannot say oh. And I stopped there. I wanted to do that, but I stopped there because of the oh.
Okay, and empathy is lacking, she said about the fall. Exactly. Similar, didn't rule out the DD's admission, also address the patient concerned about the pain. Okay.
I did rule out the DDs, the pulmonary embolism and
Yes, you
musculoskeletal
did.
pain and
You did.
everything.
Actually,
And I was repeating the questions because I could not hear you properly. There was some network.
Okay. That can be. Actually, the stronghold your was you were trying very best and you did it. Even if you have done, you have not missed a lot of things. You have just missed very little thing. Trust me, you had followed the approach in a very good way. Actually, you were like, because you had not memorized that approach, that why it was taking so long. If it has not been taken so long, your history was perfect, but your management was not. It was not good even. Your problem was the management. Your history taking was quite good. From my, as if I am your examiner on your history part, I will give you out of 2 or 3 marks. It was quite structured, exactly that she said, but your management was not structured. For example, without telling the decision, without telling what you are going to do with the patient, you directly jump onto the patient, seeing what they are going to do for the special investigation. I told you that even whether you tell or not, it is not important. Important is that what you are going to do. So it was you should have told the patient, actually, what I'm going to do. As we are suspecting that you are having myocardial infarction, we need to admit you. We need to run a couple of tests. I am going to give you aspirin. This is not the drug you need to wait for any approval, because if you are suspecting acute MI, you need to give the aspirin, you need to give the clopidogrel. Okay, if it is the pain, you need to give the painkiller. You need not to wait. You are going to check the saturation, and if it is low, you are going to give the oxygen.
Okay, I want to ask this. Matlab, like when you told me that the ECG is fine, I lost my confidence there. I was very confident about MI, and I was going to do it exactly the same way. But when you said that the ECG is normal, I started doubting the diagnosis, that it could be something else, and I didn't know.
Now, NSTEMI. What about NSTEMI? In NSTEMI, ECG could be normal, and TROP-I could be
Normal. Yes, so I just thought of
exactly.
cardiac enzymes.
Angina is also another possible cause. It can be absolutely normal ECG.
Yes, it took me some time to realize that I messed up that part. I know I messed up the management part, but it was because I lost confidence
But
about
your
my diagnosis.
history taking was so good. The only problem was the same which we all Pakistani or the other, I don't know, most of us have, is taking long time, because you are memorizing the questions, and this is going to keep you 1 month. In that phase, if you work on it, after 1 month you will be able to directly have questions in your mind without translating.
Okay, I want to ask that if due to poor time management, or if the case is long in any way, and if during management the time ends and we have not completed the management, how do we end the station? Do we just stop there and say, okay, bye, Allah Hafiz?
Okay,
or do we end it in any particular way?
First of all, okay, Zainab, your question is quite important, but the answer is that you have to do that. If it is ending, just keep in mind that this station is going to fail. Okay. I'm not discouraging you, but for example, 4 marks are with the management and 2 marks or IPS are going to be judged. 6, you are deducting 6 marks out of the 6 marks are not there. Out of 12, 6 marks are not there. How much they are going to give you in taking history? Okay, 4, IPS 1. How much you are going to attain? 5, and on the 5 it is not passed. Average marks of passing is like 6 to 6.5. Average marks is there. So if you think that if you find like 2-minute time, that is enough, you can like summarize. But if you don't find any time, it will carry you no marks if you don't find any time. So you have to do the practice that most of your station ends up in 4 to 5 minutes. Exactly, this is one of the solution. After 2 minutes, if the bell is ringing and you are somewhere between, do all the necessary step, then you need not to repeat that. You need to say, okay, from I suspect that you are having the diagnosis of acute MI. You need not to repeat all the things if you are in the last 2 minutes. You can be smart in that way. Otherwise, you need to do that. Okay. So, for example, the time is running short. The bell is there. It is only 2 minutes. What you can say is, from what you have told me and about your clinical evaluation, I suspect that you are having a diagnosis called acute myocardial infarction. That is actually like compromising the blood supply of your heart. That's it. You have said that. Now you start on managing. For that, I need you. You will not be, then you will again prioritizing. You will not be telling the knowledge. You will telling the steps. You will be telling the steps. Okay. Answer is that you will be telling the steps.
And same for the long-term management. I have to tell it, but I will tell it quickly, like one step.
No way. No way.
Okay.
You have to be in the station. You cannot tell in the way that you are teaching someone. You have to be in the station. That is the answer. You are the doctor. Okay. You are not the teacher over there. So that I can tell the step and they will give me the marks. No, they will not give you the marks for that. Sir, okay, 2 of my stations or 3 I could not diagnose and they are passed. Okay, the question answer is that if you have followed the approach, honestly speaking, I told you there was a station in which I was suspecting in the last moment when they told me that postural hypotension was not there. I was suspecting that, and I was about to disclose for the diagnosis. I told you I'm not sure about that. For that, I will run a few more tests and I will consult with my senior. However, it seems me like it can be postural hypertension, it can be due to dehydration, it can be due to that. So you can open your diagnosis in that way, in the DD way. Okay, so you can put on the senior that they will give you exactly the good marks by making you a very safe doctor. Okay, anything regarding this scenario? Otherwise, I asked Dr. Ahmed Khubab, and he is going to do next scenario with me, so that you people, I requested him to come in the class, and he is a very genuine and learned person, and so that he can we can do in front of you one test, one sample, so that you people could have the idea how you have to approach. Is that fine? Dr. Rahman, you are in the class?
Ji, Assalamu alaikum, Dr. Hamid. I am in the class, but actually the approach you have taught us today, it's quite different from what I have practiced and each and everything. So is it possible we can just postpone it for the next one? And I can moderate a session with any one of the students right now, so that you can be like able to observe and guide more. You will be in better position, because when you will be doing a scenario with the student, so it's like you are doing 2 tasks. You are also becoming a doctor and also observing the mistakes. So I can become a patient.
You will be a doctor?
Right now, if I can become a patient, and if anybody wants to become a doctor.
Okay, so and okay, anybody wants to be volunteer himself or herself in this scenario? This is the second scenario. Any courageous man or woman? Okay, Dr. Hirali. Okay, that's great. That's really great. Just read this scenario. This is your part. This is your part. Do not read the other part. And Dr. Khubab, this is your part. Okay.
Okay, Dr. Hamid. Just give me 30 seconds, please.
Okay. No, I'm giving you people 1 minute. So
thank you.
Need to plan. Shall we start?
Sorry, my internet disconnected. I just reconnected. This is the scenario we're going to.
मेरी आवाज आ रही है?
जी डॉक्टर अहमद, आपकी आवाज आ रही है।
जी डॉक्टर हिरा, आप बोलें जरा।
Yes sir.
Okay, तो आपने पढ़ लिया सिनेरियो?
Yes sir.
Okay.
Sir, I just joined. Okay.
Okay. With Dr. Webb, you will be doing this scenario.
You can start, Dr. Hira.
Okay, sir. Hello, how are you doing today?
Hello, I'm doing fine, doctor.
Okay, my name is Dr. Hirali. I'm one of the junior doctors here. May I know your full name, please?
Oh yes, my name is Daniel Smith.
Okay, and what would you like me to call you?
Smith is fine.
Okay, nice to meet you, Smith. How can I
Thank you.
help you today?
Oh well, doctor, I have this chest pain. Oh, yeah, right now.
Oh, I'm so sorry to hear that. I know it must be really unpleasant. Are you comfortable to talk?
Yes, doctor, but it's quite hurting me right now. Yeah.
Don't worry, we're here. So by any chance, have you taken any painkiller?
Well, nobody has given me any painkillers yet, doctor. I'm in pain right now,
Okay.
doctor. Can you do
Would
something
you
for
like
me,
me to
please?
give you any? Would you like to give me any painkiller? Would you like me to give you any painkiller?
Yeah, doctor, please.
Yeah, sure. But before that, would you mind me asking you a few questions so that I'm in a better position to give you a good painkiller?
Doctor, okay, let's be just a quick one, please.
Okay, so let me get it right. Let me see if I have this right. You told me you have pain. Would you tell me where exactly the pain is?
Yeah, it is on my left side. Yeah, it's on the left side, doctor.
Okay. Would you like to tell me more about it, please?
What do you like to know, doctor? I don't understand.
Like, how did it start?
Yeah, it just started suddenly, and it's just going to the arm and to my this neck region. Yeah.
All right. And was it
Oh.
gradual or just suddenly?
Yeah, it's sudden, doctor.
And what were you really doing when it started?
I was just doing some house chores, and I was sitting just. Yeah.
Okay. And has it been continuous? What does it go and
Yeah,
come and go?
yeah, actually, doctor, it is some sort of gradual, and yeah, it is continuous, doctor.
Okay. And has it changed since then?
Nope.
Okay. Could you please describe the pain for me?
Yes, doctor, it is a sharp pain. Yeah, I can say that.
Okay. And you told me it goes to your arms and your jaw.
Yes,
And
yes, doctor.
was it the same place? Like, where was the pain when it actually first started?
Yeah, it just started on my chest, and then it started going upwards, my jaw, and then to the left arm, doctor.
Okay. And anything what makes it worse?
Oh, yes, doctor. When I lie down, oh my God, it become very worse. When I
Oh,
used to
I know.
sit
I
and
can.
to lean forward, and then that's the only way it's getting better, doctor.
I can understand. It must be difficult. Don't worry. And
Uh-huh.
anything what makes it better?
Yeah, but when I lean forward, doctor, it makes me a little bit better.
Okay, that's great. So on a scale of 1 to 10, with 1 being the lowest and 10 being the highest, could you please score your pain for me?
It's 7.
Okay. Oh my God, that's really bad. And could you tell me any other symptom you experienced with the pain, like nausea, or do you feel sick?
Nope.
Any sweating?
Nope.
Okay. Any numbness or tightness?
Nope, doctor.
Okay.
Doctor, please do something. I am in pain, doctor.
Yeah, don't worry. Don't worry. We're here to help you.
Okay, thank
Could
you.
could you tell me more about your lifestyle, please? By any chance, do you drink?
Oh, no, doctor, I don't drink.
That's good. That's a good approach. And do you smoke?
Yes, doctor, I do smoke 20 cigarettes per day for the past 5 years.
All right. So, have you thought of quitting that?
Sorry?
Have you thought of quitting smoking?
Well, no, doctor. The smoking is my friend. I can't leave the smoking. Nope.
Okay. We can talk about that later on. And don't worry, we'll just discuss that. And how about your diet? What do you eat?
Doctor, I just eat junk food. Yeah, the mostly food I eat is from outside. Yeah.
Can I know why?
Yes, doctor. I'm living alone, so there is no one to cook for me. Just why I just go to the restaurants and dine out.
I can understand must be difficult for you. We'll discuss about that. We'll modify a plan for you so that you eat properly and healthy.
Doctor, please. I don't need any plans. I just need to get rid of this pain right now. Please.
Yeah, okay. And how about your activity? Are you physically active?
No. I don't like exercising, doctor. I don't exercise.
All right. And by any chance, do you have any stress in your life?
Nope. I'm fine.
Or do you take any recreational drugs?
Nope, doctor. Nope.
Okay. So have you got a similar episode in the past?
No, doctor.
Any other medical condition?
Like what? Like what?
Like diabetes or high blood pressure or
No,
heart
doctor.
condition? And are you on any medication?
No.
Are you allergic to any drug?
No, doctor. No, I'm not allergic.
For instance, have you ever been hospitalized
No,
or gone
doctor.
through any surgery?
No, doctor. No.
Do you have the same problem in a family? Like sugar,
Oh,
blood pressure, heart?
yeah. My father died. He had a heart attack like 5 years back.
Oh, I'm so sorry. So he died because of heart attack. I know it
Yeah, we
must be
lost him.
difficult for you. Okay, so asking about the questions. I think since you're really in pain, what I have thought of is that we're going to admit you in the hospital. Meanwhile, we'll give you painkillers to relieve your pain because that's the priority to keep you
Oh,
pain
that's good,
free.
doctor. That's the thing
Yeah,
I need right now. Yeah.
yeah.
Oh.
And meanwhile, we'll run some tests, and of course, we'll be involving our seniors, and we'll do what we can do for you. Don't worry about that.
Okay,
We're here
doctor.
to help you. You're in safe hands.
Doctor, okay, thank you for telling me about that. But what is the cause of this pain, doctor? It's hurting right now. Oh.
Yeah, since we haven't done any tests yet, so I'm really not sure. I told you we'll be admitting you and we'll run some tests, and then I'll be in a better position to answer your question.
Okay, doctor. Okay.
Thank you so much for your time.
Thank you, doctor. Thank you.
Yeah, Dr. Hira, done?
Yes, sir.
Okay. जी आप खुद भी मेरा ख्याल कमेंट करें, फिर अहमद आपको बताएगा और बाकी लोग भी बताएं, क्योंकि आपकी इन्वॉल्वमेंट इसमें बहुत जरूरी है. ये बड़े हमने क्लासिकल केस डिस्कस किए हैं दोनों. Everybody should comment on it that what are the deficiencies. डॉक्टर हिरा, आप सबसे पहले आप खुद बताएं कि आपको क्या लगा कि आपने क्या चीज है जो आपको डेफिशिएंट थी, जो आपको अच्छी करनी चाहिए थी, और what do you think was good?
I think the management. I couldn't think of a good management plan, and since he was so much in pain, I couldn't understand. Should I have given the painkiller right away, or should have continued with the history taking?
Yeah, we are going to discuss about that. But right now I want everybody to give his opinion or her opinion. And what other do you think the other thing was lacking, and what do you think was good? Because it is quite important to have a good insight of your own station. It is quite important. Yeah, very good comments are there saying, but because I have noted as well, oh my God, you cannot pass that gestures that are not professional. So these kind of gestures are yeah, examination is lacking. Exactly. Disorganized history pattern, mixed up history with lifestyle modification. Yes, this was there, but exactly she kept on jumping sometime, but
regarding, because she asked diet and everything first, then she came to the medical history. That seems a bit disorganized. Yeah, you should name the investigation like ECG. That's quite important, because without ECG, you said that I'm going to run some investigation, but name the investigation. What investigation? ECG, tropipe. You will name that.
Okay.
And inflammatory markers are quite important in it. You will say the inflammatory marker, ESR. ESR is equally important in this scenario.
Okay.
Yeah. Dr. Ahmed,
Yes, Dr. Amit.
you please, because you did the scenario and you should give this comment, because
Yes. It was good because I think it's the first or second time, but some things can be, can be improved. Like time is very important, as Dr. Hamid has told previously. So, when you were asking about the smoking habits and the exercise and the dietary habits, so I think you should not go in the details of that, because you can save some time over there, because this is an emergency situation, and at the moment I just need was the painkillers or the immediate treatment. So we can decide the smoking habits and the plans, eating habits later. You just ask like for just 2 or 3 questions and then just move.
exactly.
And the other thing, what I know, Dr. Hamid can comment also. If the patient is in pain, so you can ask him regarding the painkillers, as you have asked previously. But if you can ask it like 1 or 2 more times, or you can just ask or say like that, I will be real quick, just 2 or 3 more questions, I'm coming back to you, like this. So you just can acknowledge the pain 2 or 3 times. So I think this could be a good
I
good
think
thing in that.
we should have some conclusion regarding that, but people get confused regarding that very much. I think 2 times is enough. If the patient is saying again and again, just offer the painkiller. First time
Yes.
you did very well. First time you did
Yes.
very well. Second time even you could acknowledge the pain, and after 2 times you even start ignoring the pain. He was saying I'm pain, and you kept on like, no, you cannot ignore any of the patient concern. If he's saying in pain, you have to give your some time to that pain, whatever it may be. If it's second time, third time, so you should offer the painkiller. Okay, I'm going to give you the painkiller, then we'll be talking on. Okay.
So will there be painkillers in the cubicle?
No,
I mean, are we allowed to give?
there will not be painkiller. You will not give the painkiller. You will just say.
What
And Dr. Amit,
would be the words?
yes, please.
Gigi,
Yes. What would be the words? Like, how are we going to say? What will be?
okay, I am going to give you the painkiller, and we are going to talk about that after your pain is relieved. Okay. You can say in a very simple way. There is nothing like that. You have to say in a very specific way. This is very like in a professional way. You can say this. Okay, I'm going to give you some painkiller, and meanwhile, we after that we can kept on talking. That's it.
Yes,
Okay.
and before that, before giving the painkillers, I think it's better to ask regarding any sort of allergies or any medical conditions just before giving the painkillers. So it will be like.
Yeah, this is very good, important question. But for example, if you are going to offer the painkiller, do you have any sort of allergy to anything?
Yes.
No, that's great.
And Dr. Amit, in the real exam, I got a case, and the case was of renal colic. So despite offering the painkiller, the patient was like literally in pain. So I counseled him again and again. Okay, I'm with you. And due to this thing, I scored, I guess, 9 or 10 in that station. So that's why I'm trying to say that you just really you are really like you need to acknowledge the pain. You need to acknowledge them for sure.
Okay, should I comment as a whole structure of this station? Okay, hold on. No. We will kept on starting. It will be assumed that you have the painkiller. If it is relieved, it will be assumed. Otherwise, what you can do is you can managing the patient like Dr. Kubab said, and after 2 to 3 times you can say, okay, if he's insisting again and again, you can offer the painkiller, and you will not wait. Yeah, you can say, are you okay now? You can say. Okay, from my perspective, first of all, her communication skill was quite good.
and the certain problem she was sharing with you, Zainab, were the same. She was sharing with me as well, because all of us have having the same problem, because we kept on repeating the question. We kept on saying the what patient is saying, why buying the time. This is the thing which you are going to have at least for one of your month. After that, you will reach to the conclusion. You will not need to like repeat the patient question, because we will not be needing to, by the time the question will come in our mind directly, that will take some time. However, this is again one of the cause it was delayed. Second thing that is quite important for me, your approach was not acute approach. That is quite important. For example, you did the Odipara, but you kept on questioning the questions which could be skipped. For example, if you ask the smoke, okay, it's the acute question. You could say, okay, it's smoking, it's okay. Go to the next question. Smoking, how long do you drink? Okay, even if that should be prioritizing, the priority was you should have, do you have any long-term medical condition? This is priority question. She's smoking or not, that is not now the priority question. That's why we have already put an approach that we have prioritized already. So from your overall structure in the history, the lacking was organization. Otherwise, your dealing with the patient was quite good, your sentences were quite good, and your communication was quite good. However, that was not structured one. Unimportant things were as prioritized as the most important things were. So prioritizing the information in acute cases is quite important. Definitely regarding the management, you couldn't tell anything. For example, you should, first of all, if you couldn't have the diagnosis, I understand that he made some swing by telling that the pain is going towards the jaw, okay, because the suspicion of MI came here. Okay, when the suspicion came here, what you could have done, from what you have told me, it seemed like some cardiac pathology is going on, but I am not sure about that. For that, we need to run some specific tests, such as your ECG, your troponin. However, I need to keep you admitted. For example, if it has been the case of pericarditis, like it was the case of pericarditis, along with, if it is the case with acute MI as well. So if we have to deal both these cases, for example, it is a mixing of symptoms. So which one is the worst? Acute MI. If the acute MI is the worst one, we have to keep in mind acute MI along with having that. But if it is the only the pericarditis, we could send the patient home with painkillers and with the safety netting and all that. For example, this is the management. Okay, come to the management part. This is the management. This is the ECG. They will give you, from my assessment, your chest pain, the pain which relieved by leaning forward and worsening by lay down, history of flu-like symptom 1 week. Because you haven't asked about, he should have told you about this as well. If you have asked, it seemed like pericarditis. The pericarditis is the inflammation of pericardium. This is you have disclosing the diagnosis. If the test came back, you have already sent for the test. If the test came back normal, we will send up. Now you will keep the patient in observation because you have the suspicion. Then after tests are coming back normal, because you have done what? Tropi. So then if the tropi become normal, you can send home. We will give you anti-inflammatory drugs, you will give the painkiller. And if the symptom, this is the safety netting. If the symptoms persist for 10 days, then give you the medicine called colchicine, which help you improve the outcome and chance of coming back. If the patient is the proven, then the steroid can be offered. Okay, this is not needed. This is the extra information patient should ask you. If he's not asking, you went to the second line of management. No need to tell about the third line of management, because this is the error if we're going to jump toward the third line of management without the patient consideration. Okay, so this is the whole management of this acute pericarditis. So what we will be learning here in the management is the steps. First step was what? Disclosing diagnosis. Second step was to telling the patient we are going to keep under the observation, and meanwhile we're giving you the painkiller. Everything is normal, kuch or nothing to be added.
So we have discussed 2 cases so far. The problem now, what I find is you are not reaching to the management. So you need to practice the data gathering more and more. I will be having another lecture maybe on Monday. I'm going to see which day will be my lecture. It most probably going to be the 2 lectures continuously on 2 days, in which we will be discussing. Now we are going to be discussing more of the medical stations, because the approach is done. We are just going to learn how to manipulate this approach. We are not going to talk about this approach. If somebody want to learn about this approach, I'm going to put this on our channel in the YouTube. You can go there and you can watch this approach as well. Any question up till now? Students, any question you want to ask? Anything like you want to give the feedback, you want to like ask anything, you're free to ask. Otherwise, today the part of today class is done. Okay, I assume that you have learned something. If you're not asking something, and I assume that our lectures are making some difference in your learning, because we are doing it for you guys. And if you are people want us to change some strategy, we are happily going to change our strategy. Mainly primary concern, like the patient, are you people. The you people, our students, are the primary concern here. So any feedback you people want to give. Other time I was happy. One of my student gave me the opinion. I thanked him, like he's giving me. Actually, whenever you give the feedback, you are making us stronger. You are making our approach stronger. Okay, so yes, sir, a huge difference in our knowledge and approach. No, we will be, inshallah, we will be doing best for you. This is 1 month session, and we are going to complete it by, and we are, our team is there. And in the next session, tomorrow is the Dr. Junaid class. My exam is on. Thank you very much. And whatever need you need, we are here to help you in any regard. No issue with that. Thank you, everybody. And tomorrow will be the Dr. Junaid's class, and it will be on the procedure. And he is excellent in that. We have divided course in such a way that the person who is he is good in that, because I have done MRCP 1, MRCP 2. I thought my medicine would be appropriate to teach. Similarly, Dr. Adil has a good grip on the counseling approach. Dr. Junaid is on the examination approach. So similarly, other doctors are going to teach you as well. Dr. Hira is going to take lecture on gynae and peds. There are other lectures. Dr. Shiraz is going to take lectures on peds and dermatology. I think we have divided these approaches for you. Whichever is best for you, we have taken that approach. Thank you very much. Take care. See you next time.